Go to Healthworks.
What we're going to do here, we're going to do an Astym treatment, and what Astym is it's a therapy that identifies and breaks down scar tissue, fibrosis, degenerative tissue. So with the pain that you're having in your patellar tendon, we're hoping that we can alleviate some of that through this process. I've already rubbed the cocoa butter on your skin so that the tools can slide over your skin more easily, and you'll feel the bumpiness as the tools roll over, and that's the scar tissue, the degenerative tissue, the fibrosis that we're trying to break down. And after we break it down, after a few treatments, we'll use exercises to encourage that tissue to heal in a more normal and more functional pattern. Okay, so I'm going to run the big tool over here first. Feel a little bit more bumpy tissue right through there, right?
Yeah.
We're going to go in the other direction here now. Everywhere else it felt pretty good, maybe a little bit right there coming down into this old scar that you've got. I'm going to run a smaller tool over here. And this one, being smaller, is going to get a little bit deeper. We can feel a little bit there. And that redness that you see popping up right through there, that's perfectly normal. But this one gets a little bit deeper. And we'll pick up a few more things. We can feel that right there, right? And you feel it, and it's different. And it can be uncomfortable sometimes, but typically not.
Yeah.
Typically just a little different. We can feel that right through there. Again, finding the scar tissue, the fibrotic tissue, the degenerative tissue. And how do we get that stuff? We get that through trauma, and we get that through overuse. Every little injury that we have can cause us to develop that tissue. So I'm going around the kneecap here. I'm going to come down off of the fibular head a little bit. From here, and I'm going to have you go ahead and scoot back and lay back a little bit, and then you're going to bend this knee for me and lay back and relax there for me. Thank you, sir. And we're going to focus on around this patellar tendon and this scar tissue that you've got right here. For the folks watching on the video, I want you to know that this is by no means a complete knee Astym treatment, a complete lower extremity Astym treatment. You're only seeing part of what would be done. Feel a little bit more grittiness around there. We would expect that with that scar tissue. And of course, the patellar tendon being taken for that ACL reconstruction that was done on you. So again, this is just the beginning of what would happen to you in a rehab setting, because we would want to use the exercises and attempt to remodel that tissue in the long run. We're taking the tissue back to the initial stage of inflammation and healing, and then we got to give you therapeutic exercises that will help to, again, reform and remodel that tissue as it heals to work more functionally. Hopefully get rid of that tendonitis in that.
When your body hurts, go to Healthworks.